The high cost of travel nurses could trickle down to you as a patient. An American Hospital Association briefing says hospitals have been forced to use more expensive travel nurses because of staff shortages made worse during the ongoing pandemic. Liza Lucas shares how this change is impacting nurses and hospitals you turn to for care.
I often wonder, where have all the nurses gone?
That's the question Jody Leonard, a nurse with nearly 25 years experience, finds herself asking.
Most hospitals are doing what they have to do to get staff because without nurses, the hospital can't function.
It used to be a short-term fix. Hospitals turning to travel nurses, contracted positions used to fill gaps when needed. During the pandemic, many nurses picked up their lives to care for patients on the front lines. But with burnout, turnover, and nurses retiring, staffing challenges continued, and so did the need for travelers. Pat Horton with the Georgia Center for Nursing Excellence explains.
The challenge with that is the cost of travel nurses. That has become exorbitant and it's not sustainable.
What's happening is that the staff nurses are seeing the nurses around them are making 2 and 3 times what they're making, and it's very frustrating.
Job postings in Georgia show a travel nurse could make more than $4,000 a week. 11 Alive reached out to local hospitals for perspective. Emory Healthcare says they're seeing contract nurses being used 5 times more often compared to pre-pandemic. Piedmont Healthcare says they're paying contract agencies an increase of more than 200%. According to the American Staffing Association, the issue comes down to supply and demand. With fewer nurses available, the group says staffing agencies have offered higher pay to retain travel nurses, which drives up cost of services. The pay plus flexibility enticing more nurses in permanent positions to consider travel gigs.
The pay has risen so high. Many nurses have also chosen to go and travel, which you can't blame them.
And that includes Jody.
It was a tough decision for me because I've been there for 6 years and it's been my second home.
In Atlanta, Liza Lucas, 11 Alive News.
Grady Health System confirms they've also had to hire temporary staff, and the cost of recruiting and keeping nurses is leading to some budget shortfalls. Grady expected to spend an extra $80 million just on staffing alone this year. The hospital is asking Fulton and DeKalb counties for emergency funding to help. The hospital says if they cannot hire enough staff, they're going to have to close beds. We reached out to those counties to see when they could make a decision on funding. We'll keep you posted.